Good evening. We are Bobby and Patty Dwyer here to welcome you. Many of you here tonight have been with us from day one. You all understand the journey, and we are so grateful to you for still being with us. No matter what your role is, you have experienced cancer in some way. We're here to say that this is one experience and effort that will help everyone in this room.
The dinner idea was John's. It was about 2 years after he had been diagnosed. He said, I need to raise money to fight cancer. And what he did, he went to the people who owned the Trellis restaurant in Williamsburg, down on Merchant Square, convinced them to close the Trellis restaurant for one night. And John was able to use that. All proceeds went to fight cancer from that event.
John, being the founder of this, when he passed away, Bobby here refused to let it go. It was very, very important to keep it going, not only for the cause, but to remember and honor John and Maynard in their journey. Years later, when I was diagnosed with my cancer, Mark Ellis came into the picture as my oncologist. And as soon as Mark heard of my diagnosis, he said, okay, I'm your doctor, and this is how we're going to do this. And as we all know, unfortunately, he passed away of the disease. Then it became really important for us to add his name to the event.
Well, my cancer was discovered in 1999 when I was still in New York. And I went through a variety of treatments and treaters, and then decided to leave New York. And one of the New York cancer doctors said, one of my patients had gone down to Williamsburg and gone to a Dr. Miller. That's the only name they knew. So I called Dr. Miller, and of course, what a charming man. And the whole enterprise, the nurses, the accessibility to where we live in Williamsburg just made it a natural. And so we've been seeing him since, I guess, about 2011, 2012. And first of all, it was fairly intense, variety of treatments, including Keytruda, which is why I'm alive. And now that my PSA for the last couple of years has been 0, I've been getting blood tests there twice a year with the same happy results. Giving to Riverside Health was because of Dr. Miller, and that's where we started. And sitting in one of the periodic meetings there and being tested and finding out that somebody was having difficulty being a patient treated on a bed where they couldn't get up on the bed, and found out that there were beds that tilted, and was able to buy one, and the next year we bought one more. I think they're imported from somewhere in Europe, so it wasn't as if they're around the corner. And so those were the first things we did, which was really very, very happy occasion.
The foundation dollars have a great impact on our clinic, huge impact in patient care, which is what the bottom line of things is for us. So over the years, it has helped out with the technology just in our clinic that we have to offer the patients. A few years ago, through a generous donation of a benefactor who is probably sitting in the audience tonight, we started the process of changing all of our exam tables. And now we have all electronic tables. And it's a story I tell people a lot, but the first week we had those tables, I have a patient who's a paraplegic, and so he's been immobile for decades. And we actually put him on a table for a physical exam, and after I checked him out, he actually cried and told the nurses, he's like, that's the first time someone has put me on an exam table in over a decade to check me out. Sometimes when people are going through cancer care, he can be dehydrated, not feeling well. And sometimes one of the most difficult aspects of care is actually getting access to veins or putting in lines, just simple IVs for patient care. So through generous gifts, yet again, we have vein finders in our office now, and our nurses are going through the training in order to make it easier to provide the care that patients need.
And just talking about it with Dr. Miller, mentioning that there is a new AccuVein treatment, damned if I know what it is, but it was something that was evidently going to be quite useful. So we stepped up within our extended budget and got 2 of these things.
Just the impact is so much deeper now that it's available, that there are go-to group of people within Riverside that can really help people out quite a bit.
I mean, it is a real privilege to be able to donate. I think we donate various places for various reasons, and there's some places I used to donate to, I don't anymore. Riverside was very special. I mean, the need was there, was very tangible, was very visible. With luck, I'll be living in Williamsburg for at least another decade or so, and I want to support this place.
A lot of times when you donate money to different organizations, the question is, well, where is that money going, or what does it do? But here you have friends and neighbors that you may not even realize that they are benefiting from your dollars that are helping our foundation to go out and do great deeds for our community. So I just want to really, from the deepest appreciation from the bottom of my heart for everything you've done to support our organization.
It's a fuzzy reaction, but it's a very visceral reaction. My wife is hugely supportive of these gifts, and we're glad we've been able to do it.